Hi, my name is Leonard Hughes. I'm giving you a tele tip of the week. Just want to go over a couple of things here. So, when we're looking at cardiac monitoring, we're giving it a document for OSU Wexner Medical Center. We want to make sure that we wrench in the appropriate tab. So, I'm already here on a virtual patient here with cardiac. And then I find it easy just to kind of type in cardiac monitoring. And what I want to make sure is that when I'm documenting on a patient that's just on telemetry, that we actually have a tele recall box here. I'm kind of pointed to it right here because this is going to be important when we're documenting every 4 hours uh, what the intervals are, the PR, QRS, and the QT interval. So now that we have it wrenched in, let's just say we have a patient that is currently in VTAC, and I'm going to tell you what VTAC, show you what VTAC looks like. Okay, so here's an example of like straight VTAC right here. VTAC in general, if a patient goes from like normal sinus and has like a 3 or more beat in a row of what we call VTAC here, then they're considered to have beats of VTAC. And it's at a rate of greater than 100. There's a problem with the electrical pulses of the heart here. We do need to notify the physician if this happens. This is one intervention that we do need to do. The other thing too, we need to print a telestrip, which I'll show you in some later tips on how to do that. And you also need to do a tele recall. And this is when we're going to put a little note here. We can say C note. I would even just make it a significant event. And then I would go to the note section, document a note of what I've seen. Patient has experienced a 3-beat run of VTAC, and I'm notifying the physician. And then I also added in that documentation that I put in, I did a tele recall for the same exact time. If the patient is not having any symptoms at all, no shortness of breath, no chest pain, we will continue to monitor patients. If they're having chest pain, lightheaded, dizzy, shortness of breath, any symptoms at all, we need to consider calling an ERT. That is your intervention for that patient. That's it for the tele tips for now. Thank you so much. Hope this was helpful.